endodontics. Here we go. So, endodontics is one of the most important subjects, clinical subjects in dentistry. Even now, even since years. And many questions have come from endodontics for our entrance examinations also. So we need to know certain things in depth, but at the same time, we need not go in a vast detail to many of the topics. So one such example is root canal sealers. Root canal sealers are specific type of materials which we use when we do an obturation of the root canal. When we do the obturation of the root canal, we use certain materials like gataparka and some other similar materials like gataparka, sometimes as a solid core, sometimes as a thermoplasticized version. But even if we are using in a thermoplasticized version, gataparka has an amount of shrinkage. So to compensate the shrinkage of gataparka in thermoplastic procedures, as well as to fill the remaining gap or spaces when using it as a solid core, we use certain paste-like material. And this paste-like material is known as root canal sealer. So root canal sealer is the paste-like material what we use along with gataparka or similar materials for the purpose of obturation of a sterilized, disinfected root canal system. Now let us see what are the ideal requirements of root canal sealers. The most important requirement is that it should occupy the space between the main material, gataparka, and the root canal wall. And if possible, it should not leave any gap or voids in between them. It should stick to the gataparka, it should stick to the root canal wall, so that there is no space for a microorganism to sit in between. That is one and the most prior requirement of a root canal sealer. And second thing is that ideally, if under ideal conditions, root canal sealers are not supposed to be extruded out of the root canal system. Okay, so intentionally you are not supposed to take your root canal sealers out of your canal. But even if it goes, you don't have to worry. It should not be initiating any kind of immunological reaction or any kind of irritation at the periapical areas. So it is always important that your root canal material should be an inert material which is highly biocompatible. It should not cause any kind of irritation to the periapical tissues. If at all, it gets unintentionally extruded out of the canal. So that is the second requirement. Then suppose if we complete the root canals and the patient goes with a post-endodontic restoration like a crown or an onlay, and after some years, if there is a reinfection of the canals, sometimes we might have to perform a procedure called retreatment. So retreatment of an infected root canal, we might have to remove the existing fillings, existing root canal obturation. So in this particular procedure, your root canal sealer should be easily removed. Easily removed in the sense like retreatment could be performed much easily if it can be removed. So that is another requirement which is now not very relevant, because nowadays when we do proper root canal in the first visit itself, the chances of the patient going for a retreatment is much less. But still, this is a requirement. Certain root canal sealers are very difficult to be removed from the canal, but they might give you a better seal. So this is one requirement of a root canal sealer. Suppose if we need to retreat, you need to remove the sealer easily. Then when you mix your root canal sealer, we need to make sure that the sealer has the proper consistency so that it can be easily introduced into the canal. So usually when we mix your cements, you have a particular consistency in which they start stringing out. So that is important for root canal sealers. And we need to get some working time. So suppose if we need to get some working time, your root canal sealers should set slowly. Like it shouldn't set very fast like your restorative materials. Then you won't get time to manipulate the gutta percha cones and fill your root canals. So that means that your root canal system can be obturated at a proper, precise manner if we get some working time for your root canal sealers. Then another requirement for root canal sealer is that it should be radio opaque. Why? Because when your root canal sealer is radio opaque, you can actually see the obturation inside the canal. You can even see the lateral canal fills. And you can see the accessory canal. Sometimes there your sealer will occupy. And unfortunately, if your root canal sealer goes beyond apex and the patient is having a postoperative pain, even that can be assessed if your root canal sealer is radio opaque. And another requirement of your root canal sealer is that they should be dimensionally stable. They should not shrink or they should not expand. And they should give an excellent seal once it is set. And a very important property, that is, they should be bacteriostatic. That means that they should not attract microorganisms and they should not promote the multiplication of microorganisms, or in other words, even if they are not bactericidal, it's okay, but they should be bacteriostatic. They should not encourage the growth of bacteria. So these are certain requirements of root canal sealers. So I can repeat it once more. Root canal sealer should properly occupy the space between the gutta percha and the root canal wall, number one. Number two, it should not create any kind of irritation to the periapical tissues. Number three, you should be able to easily remove it while performing a retreatment. Number four, the consistency and the working time should be good. It should be easily be introduced inside the canal and you should get a good working time. Number five, it should be radio opaque so that we can assess the quality of obturation in the radiograph and any kind of extrusion can be assessed properly. Number six, it should be dimensionally stable, should not shrink or expand and give an excellent seal after set. And finally, your root canal sealer should be bacteriostatic, because some MCQ questions can come from these topics, which we will discuss at the end. Okay, so now let me go to the next part of this presentation. How do we classify the root canal sealers? We can classify root canal sealers as eugenol sealers, the sealers which contain eugenol, resin sealers, the sealers which are made out of resin. And in resin sealer itself, you have different types of resins which we'll come across immediately soon after this. Sealers with calcium hydroxide, sealers having formaldehyde, sealers containing glass ionomer, and the most latest sealers, those are the bioceramic sealers. So this is the basic classification of root canal sealers. So this is something which you have to keep in mind. So if you see, I am basically breaking down your topic into small packets. The entire endodontics is broken down into small packets. And in that, the root canal obturation is again broken down into small packets, like the gutta percha, root canal obturation systems, and root canal sealers. And in root canal sealers, we are again breaking it into small packet. And the one is your ideal requirements. The second one is the classification. And now let us see each in detail. What are the eugenol sealers? Eugenol sealers are the ones which have eugenol. And the most historically popular eugenol sealer is your Grossman sealer, which has been used since so many years in endodontics. Then the modification of this Grossman sealer has come a lot. Other examples are EWT. EWT works for extended working time. Roth sealer, Tubli seal. Tubli seal is quite popular now also. It comes from Cybron Endo. Watt cement, Okay, these are some of the examples of eugenol sealers. So some MCQ question can come from this. Which of the following is not a eugenol sealer? Something like that. So you have to be watching out for examples of each type of sealers. Now, what are the advantages of eugenol sealers? Eugenol as a material is very good sedative, even for the pulp as well as the periapical tissue. But there is a problem with eugenol is that it is slightly cytotoxic. So when eugenol gets extruded beyond the apex, there might be a post-operative irritation. The main disadvantage with eugenol is that the eugenol, if it touches the canal walls, later, if you are trying to bond a composite, like a post and core or a core buildup with a composite, your composites may not work. So the advantage of eugenol is that even if a little bit of pulp tissue is remaining, that pulp tissue becomes numbed or sedated because of eugenol sealers. The post-operative discomfort for the patient is much less with a eugenol sealer. But the problem is eugenol sealers can inhibit polymerization of your composites. And nowadays we use composites as post-endodontic restorations. It's very important. Earlier we never used to use, but now composites are the most widely used post-endodontic restorations. So that makes your eugenol sealers contraindicated in many of the contemporary endodontics. Now, so eugenol sealers is over. Next is calcium hydroxide sealers. Calcium hydroxide sealers, the best example is Seal Apex. Seal Apex is very popular now. It comes from a company called Kerr. Then Apexit was earlier popular. CRCS, calcibiotic root canal sealer, was also a type of calcium hydroxide sealer, which contain calcium hydroxide. So the main advantage is that calcium hydroxide we use as an intracanal medicament. And when this is incorporated in the sealer, even that particular bacteriostatic effect of calcium hydroxide is there for this sealer also. Even if this sealer is extruded a little bit beyond apex, periapical immunological response is highly positive. It does not irritate the periapical area like other sealers. But the drawback with calcium hydroxide is that the sealing ability is not as good as your resin sealers. So this is how you have to study this topic. Each and every classification you have to take individually and see which are the representative products in that particular classification and study the advantages and disadvantages. So if you learn like this, the advantage is that you remember when you go for the exam. When MCQ questions are short on you, one after another, you will be able to answer it easily. Okay. So basically here I am demonstrating the method of study. Now, next is the resin sealers. Resin sealers, example is Diaket, AH plus AH26, okay, Endores, Epiphany, Real Seal. Because all are different types of resin. Diaket is a polyketone. Okay. AH plus and AH26, they are epoxy resins. Endores is UDMA, and Epiphany, they are basically methacrylates. Our more related to our bonding mechanism, this GMA. More related to our composite mechanism is Epiphany and Real Seal. And they are known to be the monoblock sealers. So if a question comes, which are the monoblock sealers, then the answer is Epiphany. Because Epiphany, they resemble our BIS GMA. And even the Gataparka cones are replaced by certain polymeric materials, which can actually give a monoblock effect to your root canal obturation. So among these resin sealers, the most widely used would be probably AH plus. AH plus is an epoxy sealer, which comes as a two-phase system. Most of the sealers come as a two-phase system, and you mix it to the required consistency and place it inside the canal. Now, what is the advantage with resin sealer? They have a very good sealing ability. And what is the disadvantage? They don't have any reparative capacity or anything. They are purely inert. And periapically, there is slight inflammation. Okay, so the main advantage of resin sealer is that it seals the canals properly. Okay, and it sticks to your guttapercha also. One disadvantage is that when you compare with eugenol sealers, resin sealers, it's difficult for you to remove them when you do a retreatment. But most of the times, if you do the treatment properly, the retreatment is not needed. So we don't go much into that part nowadays. So hope you understood what is a resin sealer. Now, let's come to paraformaldehyde containing sealers or medicated sealers, which are no longer used in dentistry because all these materials, N2, it's also known as Sergeanti paste or N2. These were used once upon a time in dentistry when we didn't have all these rotary instruments or other sophisticated kind of instruments as what we use today. When we used to do only with your hand instruments, we were not able to do the cleaning and shaping as how we used to do nowadays. So the canals were mainly packed with these medicated sealers. And these medicated sealers, they come in the form of paraformaldehyde. The example is N2. And nowadays, we do not use them because they are considered to be carcinogenic and toxic to the body. But just for the academic purpose, know about N2 or Sergeanti paste, which are paraformaldehyde sealers. Then comes glass enamel sealers. Glass enamel sealers, two examples are there. They are not much popular because it's very difficult to retrieve these glass enamel sealers for retreatment. Examples are Kitac Endo from 3M and Active GP from Brazil. So these are examples of glass enamel sealers. Then comes the latest, that is the bioceramic sealers. And bioceramic sealers are going to be the breakthrough in endodontics because they are calcium silicate based materials which are highly biocompatible and they give a good seal also. Examples are BioRoot RCS from Septodont and Total Fill BC from FKG. BC means bioceramic sealer. So you should know these brand names, BioRoot RCS and Total Fill BC, because these names may be asked as an MCQ question. So hope you understood the classification of sealers. So to make it simple, the classification of sealers are classified as eugenol sealers, resin sealers, calcium hydroxide sealers, formaldehyde sealers, glass enamel sealers, bioceramic sealers, and we need to see the examples of each sealer. Okay, the examples of eugenol sealers, out of that, tubely seal is the most important one. Example of calcium hydroxide sealer, out of that, seal apex is the most important one. Example of resin sealer, out of which AH plus is most important one. Paraformaldehyde sealers are no longer used. Glass enamel sealer, and finally bioceramic sealers, out of which BioRoot RCS is most important. And you should know the advantages and disadvantages of each system. Now, let us come to the questions. Okay, so as and when I discuss the question, you can put in the chat box the answer, because once you have listened carefully to this topic, what I have discussed, then you will be able to answer the question easily. So the first question is, all are true about root canal sealer except which? This was asked long time back, but this I am putting as an example. You can put in the chat box the answer A, B, C, D. You can type in the chat box. Okay. A is excessive use, B is sealer, C, D. I haven't put A, B, C, D, but you can just, because we have already discussed this, all are true about root canal sealer except. So this question, what you have to be careful is, in the question, there is a very important word, that is except. They are asking about root canal sealer, okay? And they are telling that all are true about root canal sealer except one. So you have to find out the one which is false about root canal sealer. So certain questions are confusing. It may not be straightforward. So always look out in your question for certain words like except or none other than, because otherwise you might end up in wrong answer. So if you analyze the answers, excessive use of sealer tends to extrude into the periapical areas. It is true, but that is not the question. Sealer mediates immune reaction in periapical region. Yeah, no, that is something which we discussed. A sealer should not mediate immune reaction in the periapical region. So we know that the answer is B. But wait, let us see C and D also, and just see whether there is any more apt answer. Certain MCQ questions may come like that also. Loss of sealer creates porosity. Yes, loss of sealer creates porosity. The sealer should be dimensionally stable. It should not create porosities between the root filler and tooth surfaces. It is true. But again, the question is not that. The question is which is wrong. Sealer occupies the space between root filler and tooth surface. Again, that is true. So now you can be sure that B is the answer. Let me see the chat box. Yeah, everybody has answered B. Good. So this is how you should go with your MCQ questions. Don't hurry to answer the question. Take your time. Make sure that you are relaxed while answering the questions. Okay, these are just examples what I am giving. After this, you have to go back to your books and see all the questions what have come from this particular topic and try answering them. Now, let us see the next question. UDMA resin-based endosealer. Which is the UDMA resin-based endosealer? So now they are asking a very specific question. Means they are not asking which among the following is a resin-based endosealer. They are asking which is the specific UDMA resin-based endosealer. That means that you have to really know the each and every type of resin sealers. Okay. So you have EndoRes, Real Seal, Rocco Seal, and Tubli Seal. So suppose if you are in a doubt to answer this question, you can always go for something called as an elimination technique. In elimination technique, suppose you haven't read about EndoRes. Okay, you don't know the answer. What you can do is you can start with eliminating the things. You know that Tubli Seal is an eugenol-based sealer. So definitely the question, the answer should be excluded of Tubli Seal. Even Rocco Seal also. So Rocco Seal and Tubli Seal, they are eliminated. Then the remaining two is Real Seal and EndoRes. And in Real Seal and EndoRes, you know that Real Seal is more of BisGMA type of endosealer. So you eliminated Real Seal, Rocco Seal, and Tubli Seal, and finally the answer is EndoRes. This is called the elimination technique. So that is how we come to the answer as EndoRes. Okay. So even if you haven't covered that particular topic, sometimes you may be able to answer the question with this elimination technique. So in the first question, what I wanted to tell you is to watch out for the words like none other than, except, okay, which is the best something. So there might be more than one or two answers. So you have to be careful like that. In the second question, I wanted to tell you about your elimination technique. Now, lorothidol in non-eugenol paste has the function of, what is lorothidol? This came in COMED K 2013. The answer is fungicide. So sometimes you might have to directly learn certain things from previous year's question paper. That is the reason why I tell you, sometimes you may not come across all these in your textbooks. This is quite new. It was not even mentioned in your classification. So certain questions like this, you get the questions only by answering your previous year's question paper, which you have to do. These questions may repeat again and again. Okay, so that is another way of studying for your entrance examination. So note all these points. Now, extrusion of sealer from root apex will cause. This was asked in PGI June 13. Again, just like your first question, read properly, irritate tissue and delay healing, stain periapical tissue, resorb the root, lead to closure of the apex. So when you have such questions like this, in which you may feel that more than one answer is correct, make sure that you answer the one which is more apt. So in this particular case, the one which is more apt is, let me see the chat box. Yeah, that is, the answer is A. Very, very correct, very correct. Because sometimes you might feel that your B, C, D, they all may be right, but make sure that the one which is given in the literature, okay, the one which is most apt, you should answer. So in this particular case, the answer is A, irritate tissue and delay healing, because we just covered this in our topic. Because a root canal sealer, even if it goes beyond apex, should not irritate tissue and delay healing. But extrusion of sealer is not indicated because of this particular thing. Because when you extrude the sealer, it can always irritate the tissue, how good the sealer be. Got it? The ideal quality of a root canal filling material. So sometimes in NEET and all, silly questions like this come. Very silly, straightforward question, which you have already covered. So don't break your head in such questions. Move fastly, especially if you have seen that in your guides before. Don't think too much. Yeah, all of you are doing it good. You have got it very correct, very good. And this is how you should learn for an entrance examination. So didn't I make it very simple? So let me have a feedback from you. Can you on your camera and let me know like how you felt about this session?
Very good, sir.
Yes. So I want you to unmute and tell me like, can we do it? Is it an easy way of studying for exams? Because this is how I studied for my exams, my entrance exam. I broke down each, and that was years back. Okay, that was, I studied for my entrance examination in 2001. So probably 20 years back also, I used the same technique. I did not go and read all the textbooks. No, it is not practically going to be possible in the next 4 months to read all the textbook of dentistry. No, the only way we can do is we can take these guides like Pulse and Neeraj Wadwan. They are actually good guides. They also have given explanations. So rather than you need to answer a lot of questions, and from these questions you have to go back to the topics. And in our classes we will discuss the topics which are just needed for the entrance examination. Any extra information what you want, you should go back and refer the textbooks. Any questions from any one of you? Dr. Biji, Dr. Monica, are you good? Was that easy?
Yes, it was.
Okay. This is the game, and from August 15th, we are going to have very intensive training. Okay. Every day we will have sessions, and every day you will have tasks. So you have to complete the task. It's like a game. Okay. The training is going to go for 4 months, and after 4 months, we need results from you. And that's the most important thing. Okay. So be prepared to work hard. Keep away all your other engagements for the next 4 months, 5 months, because if you just concentrate on these time period, you can make it. All right. So thank you for joining me. It was indeed a pleasure seeing all of you. Thank you once again. See you for the session after August 15th. Bye. Good evening.
Thank you, sir.
Okay, sir. Hello.
Yes, Naufra.
Hi, sir. Yeah, I had one small request. Okay.
Yes.
So a lot of our students had this, they had expressed some kind of concern that whether they'll be able to make it in 4 months. First of all, that is concern number 1. And the concern number 2 is a lot of them are preparing after a long time after their graduation. So they have a big break. and they have responsibilities, family, everything. So a lot of students who recently joined, they have expressed these concerns, and I hope that you can give some insights from your past year's experience, and definitely there is nobody else who can give some insight for them regarding this part.
I'm pretty sure that like once we come out of our comfort zone, okay, we are actually able to scale higher. So if you in fact try to accommodate everything within your comfort zone, then nothing is possible. So you have to make some compromises. You have to keep some priorities. And one priority for the next 4 months is this exam. So what I request all of you is to always have a plan B for other things. For example, if you are working in some clinic, plan to take a break for some time just for studies. Okay. Even in your family, you tell your family members that for the next 4 months, like I need some time for myself. I need a little bit of help from all of you. Like make the communication very, very straightforward and easy with others around. Okay. Even financially also, we might need some help in the next 4 months because you may not be earning. So you have to request the help from your family members. And at the same time, like those who are attempting after a long time, don't worry about it because the basics in dentistry haven't changed. Only some additions have come as the latest techniques and materials. Because if I tell you an example, the bioceramic sealers, I have added it today in my presentation. It was not there when I took the class probably last year because it became quite popular in the last 1 year. So we also update ourselves and give you the latest. And many a times your examiners, they tend to ask from the latest questions. So which we are going to work for you and give it to you. So all you need is to be with us, follow our timetable, and give your best. And make sure that you have a lot of support in and around. Okay, you tell your family members, tell your clinic, everyone that for some months you are going to be compromised, and we are going to have the result out of it. Any questions individually also you can ask me. You can unmute and ask me. If you are not comfortable asking me directly, you can even WhatsApp me. You can get the number in the group.
Sir, will there be any test series will be there, sir?
Yes, test series will be there. You have to write the test series. You will have rankings among yourselves. Okay, so we'll come to know like from after every test series, you will become better and better. Okay.
Sir, there was one question from Dr. Prakriti in the chat box. Please.
Sorry, I didn't actually see the. Yeah, one bioceramics. Yes, sir. You did not mention any disadvantage. Yes, bioceramic sealers. The disadvantage is that it's very expensive. It's a new sealer, but it's very expensive. That one particular tube will cost you somewhere nearly thousands, like 10,000, nearly 8,000, 10,000 rupees. So that's the main disadvantage of bioceramics as of now. But it has a lot of good qualities.
Sir, actually, I wanted to know what is the pattern of the NEET exam. I'm not aware of it. I'm writing for the first time.
Don't worry. Our test series, what we give.
Not ours, sir. I wanted to know the main exam. How many questions?
Yeah. So the thing is that, like Monica, like what we are doing is our exams. What we give you as training sessions will be a miniature NEET. Okay, the same number of questions. Suppose in the NEET it is 240 questions for 3 hours. About the miniature exams, what you are going to write will be 120 questions for 1.5 hours.
Okay.
So you are slowly going to get conditioned. Your mind, your brain, your body will be tuned to attempt those 240 questions in 3 hours. Because all the mistakes you might have made during our exams, and we might have corrected you also. So there is no problem. There won't be any problem for you when you go for your final exams. Okay, so don't worry about that. We'll take care of that. Any other questions? Yeah. Yes, yes, Hafiz. It is a bioceramic sealer, Cerasi. Now there are a lot of new bioceramic sealers what is coming into the market. So if you have any queries, you can personally message me. I'm more happy to answer that. So now, Farah, shall we wind up today's session?
Sure, sir. Thank you so much for this session. Once again, as we hoped, it's always the best since it is from your side. So I hope everybody had a great time. We can meet with the next webinar, right, sir?
Yes, yes. So meet you all in the same platform. Take care. Okay. Please do keep in touch if you need any help. Bye. Bye for now.